Hi there, my name is Mitchell Warren. I'm the Executive Director of AVAC, and I am so happy to be invited to share some remarks with all of you, and just so sorry not to be there in person or even live at this particular moment. But I'm so grateful to have the opportunity to share this message. As we all gather here in early July, just weeks before the International AIDS Conference taking place in Rio de Janeiro in just a few weeks' time, this is one of the most critical moments in the HIV/AIDS response. Now, of course, we've said that many times over the last 45 years. It was important many, many years ago when all we had were condoms and behavior change programs, when getting a diagnosis of HIV meant a death sentence because there was no antiretroviral treatment. And it was a critical moment then to advance the development of antiretroviral treatment. Fast forward to the late 1990s when antiretroviral treatment was developed but wasn't available to the vast majority of people living with HIV. That was a critical moment in the field, and it brought us both the Global Fund to fight AIDS, TB, and malaria, as well as PEPFAR, the President's Emergency Response for AIDS Relief, in the early 2000s. And it's because of those critical moments that we now have nearly 30 million people living with HIV accessing antiretroviral treatment. And yet, we still have gaps in that coverage. We still have people not diagnosed and not receiving the life-saving antiretroviral treatment, both for their own lives as well as to prevent onward transmission. And yet, it's been a critical moment in HIV prevention for the past 12 years with the development of safe and effective pre-exposure prophylaxis, or PrEP. So we could move beyond male and female condoms. In 2006, we began to offer voluntary medical male circumcision, which we know to be a safe and effective intervention. And then in 2012, the approval of the first PrEP agent, an oral PrEP pill taken every day. And it was a critical moment then that we make good on the science and deliver PrEP to all who could benefit from it. And yet we failed to meet that moment. Lo and behold, years passed. We have now dapivirine vaginal ring and injectable cabotegravir that came into the market in the last 5 years. And it was a critical moment then to deliver them with speed, with scale, and with equity, and yet we didn't. So here we stand in July of 2026, where we have the latest intervention, injectable lenacapavir, an every 6 monthly injectable, that is a remarkable product. But so too is cabotegravir, so too is the dapivirine vaginal ring, so too is oral tenofovir emtricitabine. So why is this moment more critical than any of the past? Well, it's a cruel irony that the greatest scientific opportunities, including lenacapavir, have come to us just as we face the most challenging political and economic time in the HIV/AIDS response. And it started on January 20th in my country, the United States, and tragically, political leadership failed. Political leadership not only failed to meet the moment, but political leadership began to peel back the great advances that now inhibit our ability to translate great science into public health impact. And that is why this moment, more than possibly any other in 45 years of the HIV/AIDS response, is the moment that we have to rethink what we do, why we do it, how we do it. We need to rebuild. We are not rebuilding to January 20th. We are rebuilding an entirely new architecture that not only needs to deliver on HIV and AIDS, but needs to deliver on tuberculosis, malaria, non-communicable diseases, a range of sexually transmitted infections other than HIV. And we need to rise to meet this moment in a way that we have not as a collective, as civil society advocates, as researchers, as political leaders, as funders. This is our moment because we have the opportunity to do what we haven't been able to do in 45 years, to help get everyone living with HIV access to antiretroviral treatment, to help get prevention in all its forms, condoms and circumcision and PrEP, to all who can benefit from it. That we need to rebuild the scientific enterprise to make sure that we still develop a vaccine and a cure. Because we can. Because we can and we must. So as people think today at this important meeting, as well as think ahead to the Rio conference in just a couple of weeks. This is our moment to come together, to rethink, to rebuild, to rise, to put communities at the center, and to do what the science allows us to do if we choose to act on it. I hope you'll join me. I hope you'll join colleagues around the world, everywhere, in rethinking, rebuilding, and rising. Thank you so much and have a great meeting.